thank you for joining us. Thank you. Thanks for joining us this morning. You have many of the HR team here with you today. So we'll start with some introductions first. My name is Jackie Swaro. I am the benefits supervisor, and I'll let the rest of the team introduce themselves as well.
I'm Fabiana Di Camillo. I'm the health and well-being coordinator for CSU, and thank you for having us.
I'm Brittny Phillips. I'm the Senior Benefits Communication and Compliance Administrator. Happy to be here.
I'm Audra Montoya. I'm the Employee Housing Programs Coordinator.
And we have two of our benefits administrators here as well. If you'd like to introduce yourselves.
I'm Jessica. I'm one of the benefits administrators. And I'm Erin. I am also a benefits administrator.
And as you notice, all of our titles are very long, so if you don't remember, it's okay. You know.
All right, so I'm gonna turn it over. They'll start first. So
we have the presentation split into two. We'll start with some of the well-being resources and then move into the more traditional, I guess, when you think of benefits, health, dental, leave, things like that. But Fabiana and I will get us started. So our agenda today, it looks long, but we'll move quickly because I know we don't have a ton of time. If you have questions as we go through the presentation though, certainly feel free to interject and we'll address them. And then before we get into the fun stuff, just a quick reminder that this is a summary of only some of the benefits that we offer. If we happen to say something that doesn't match up with the plan documents will always govern, but we won't do that. We don't ever say anything wrong, never. So hopefully last summer, I can't believe it's already been a year since we launched the Wellbeing Hub. There were source articles, quite a few emails from both HR and the President's Office. We put a lot of work into this website that brings all of the campus and community resources available to employees into one easy to navigate portal. So if you haven't had a chance to check it out, it's bewell.colostate.edu. And then everything's divided by category. You can go in there and see resources that support all these different aspects of both your work and home life. And I'll hand it to Fabiana.
Oh, thank you. So as I said, I'm the employee health and well-being coordinator, and we have CSU offers a wonderful EAP program, and sometimes people are not aware of that it exists and how to get connected. So this is it, and really an EAP program, what it does is help employees access certain resources such as counseling, coaching. There's all kinds of information on the website, and there's a link over here. So that's my contact information on site. So you could certainly reach out to me by phone, email. I'm always on Teams, so certainly reach out to me on Teams. And I could provide assessments and referrals, management consultations. So not only one-on-one for individuals who are struggling and they have questions about the EAP, but also for management or teams that maybe they want to hear about a presentation or they want to hear about a topic related to mental health. I'm also a mental health provider. I'm a licensed provider in Colorado, so I have that background. We do departmental support in terms of when there's a crisis or there's some employee or student death. So I'm part of that team as well that I can help and support. So even if something may not necessarily be going on with somebody individually, but I could support the teams within CSU and be there. So in a lot of what we do, as we're doing today, is mental health and well-being education programs or webinars, and certainly always do not hesitate to contact me. So the third party that provides the counseling, the coaching, and some of the financial services that CSU offers is ComPsych. So you directly, anybody at the university who is a benefited employee or can get benefits, they can contact ComPsych directly. So you don't necessarily need to go through me to get in touch with ComPsych. You can, and I'm happy to help navigate that. But the 1-800 number is a 24/7 phone number that's available to the employees, as I said. And by contacting CompPsych, an employee can request referrals for counseling or coaching. So it's kind of the portal to gaining all those resources that are provided to CSU. For higher risk individuals, there's the possibility of accessing first same day services, either through CompPsych or community resources outside of CSU. And you could always contact me and I could explain that in more detail. So another one of the services that we offer at CSU is Silver Cloud, and this is an online platform, and it's confidential and self-guided programming. There's modules there, it's always open, and it's for students and employees as well. And it's based on clinical experience and mostly cognitive behavioral therapy, which is a type of therapy that focuses on changing behavior and changing the way we think about ourselves and the world. And it can be pretty structured, and it could be very useful for individuals who are trying to focus on a behavior or change something about their lives. And the next slide is going to be...
Many of us suffer from problems that affect our mental health, and taking a step to a healthier mind can be difficult. To help us with that challenge, we've spent over 15 years researching and building Silver Cloud, designed by clinical experts using proven methods for helping people, all with the aim of empowering you to think and feel better. The result is an online space that's secure, anonymous, and supportive, that offers easy-to-use interactive programs with interesting tools and tactics. Our programs are tailored to your needs, helping you to learn new skills to approach the challenges you're facing. Silver Cloud is designed to be flexible, fit in with your schedule, and be accessible whenever, wherever suits.
That always surprises me. It comes louder than I expected. It gets startled. So sorry about that. So one of the benefits that the EAP through CompPsych offers is well-being coaching. So I mentioned counseling, and counseling employees can access up to 6 individual sessions per year with a counselor, and those are individuals who are licensed in the state of Colorado. We also have the ability to access well-being coaching, which is a little bit different than counseling. And all the well-being coaching sessions are either done on the phone or on Teams or Zoom. I think it's Zoom they use. And this is a relatively newer service that CSU is offering. It's over a year and a half or so that has been offered. And to access appointments with a well-being coach is the same phone number that it is for the CompPsych. So everybody's welcome to access this, and it's also an individualized approach that people usually reach out to a well-being coach when they're trying to maybe change a behavior. It's similar to Silver Cloud, but this will be with a live person that you could actually talk to and schedule appointments. I think the benefit of the well-being coaching is that I try to remind everybody that I come in contact with is there's usually more coaches available than there are counselors. So it could be an entry point to getting to talk to someone about something that's going on with us. And the initial amount are 5 sessions with an individual coach that could be added depending on what else is going on with the person. And in having a conversation with the coach, we could say, hey, I feel like I still want to work on tardiness, making that as an example. And I would like to meet with you a few more times. And then you directly work with a coach to schedule additional appointments. The coach may be somebody who's certified, but is not licensed. So like I said, there's more available, and it could be somebody who is in Florida. I worked with somebody because I wanted to try out the service, and my coach was in Florida. And it doesn't really matter because they're not bound by the state of Colorado licensure. So, and it was, I had a great experience with it. It's not as deep as counseling, but it could still be a guide that we could use. And I encourage people to use any of these services. By the way, coaching and counseling are free and confidential through the EAP, so.
Fabiana?
Yes.
Just for clarification, it's 6 sessions through CompPsych, and the 5 sessions well-being are additional, right?
Yes.
the 5 don't count toward the 6.
Exactly. Thank you for clarifying that. So
Thank
it's
you.
separate. So one, if you think is a tier of the counseling, there's 6 per year. And then the other tier is coaching, and there are 5, and they're renewable, for lack of a better word.
Got another question.
Yes, please.
So you said, is this available to students or just Silver Cloud or?
Silver Cloud is available to students and staff and faculty. The EAP is only available to employees.
Okay.
The students have their own mental health services through the health network, and they can access that.
Okay, cool.
Well source. So it's also part of what ComPsych offers, and this is online interactive financial wellness tools. So we could use them as well. You are able to create individualized guide, and there's amazing amount of resources for finances and information about, I don't know, how to save money or how to open a bank account for those individuals that haven't had that. So it is, and there's a QR code there, great. I'm glad you. All these resources could also be accessed through guidanceresources.com, which is the online portal for ComPsych. And once you sign up for it, and with more time, or if you need help accessing that, I'm happy to help you individually. They will ask you for a web ID, and the web ID is CSU EAP. So once that portal opens, there's tons of information. There's resources, there's webinars, there's an area there that you could actually ask questions to, like a chat with somebody on the other side. So it's really helpful. So this is more or less what the ComPsych guidance resources will look like. And of course, you would have your own signing, your name and your password. And then I use it almost every day, not only for me, but to guide other individuals that may have questions within the university. I also forgot to mention that for the counseling piece of the EAP is not only for employees, but employees' families, household members can also access those 6 individual sessions. So that's another great benefit. You at CSU is another online platform that provides tips and information about well-being. What I like about you at CSU, it's also a portal, an online portal that provides a lot of community resources in addition to what the EAP within CSU offers. So if somebody's looking for inpatient program for mental health related or substance use treatment, they could find that in the U at CSU. It's been updated recently, and it is much easier to navigate, I feel. So it is also, you can create an account with your name and logging information.
Fabiana,
Yes.
we had a question going backwards just a little bit
Oh,
from
great.
our virtual participants. Does each family member get 6 sessions, or is it 6 per family?
Each family member can get up to. Some people don't
Gotcha.
need the 6 sessions, right? Some people go in and maybe meet with somebody twice or 3 times. But thank you, that's a good question.
Thank
Yeah.
you.
So all of this, of course, is confidential, it's free, it's a tool. Like I said, it offers resources and tips for managing stress, balancing work-life, which is one of the main purpose of having an EAP program, right? To support employees while they're at work, but also in their personal life. What's going on in life that's affecting our work, or vice versa, right? Checking for time.
I was, Fabiana, just gonna mention also that you at CSU is available to students as well. And it's tied to your EID, so you don't have to create a separate login. And student
Yes, thank
platform's
you.
a little different, but it's available to them as well.
Yes. So thank you, Brittny. That's a good point. So I'll talk a little bit about the CARE program. This is a program that Emma Chavez overseas, but she couldn't make it today, so we're gonna go over it. And I think her contact information is on this slide, so you're welcome to contact her directly or contact me, and I could put you in contact with Emma if you have any questions. So CARE stands for Connect and Refer Employees, and if you've ever been on the website, it's amazing. It has tons of information about community resources and about resources within CSU as well for employees. And some of the resources overlap between employees and students, and the CARE program website will explain which ones are specifically for students, which are for both, or some, like I said, the EAP is only for employees. So the CARE program, you could get a confidential one-on-one meeting with Emma. I covered for her for a little while, so I've done that as well. But Emma is back now. She does a lot of help in terms of sometimes filling out applications or guiding people to low cost or free services within the university or outside of the university. There's a lot of advocacy that she provides for employees as well, partnership with the communities. She is bilingual, and so am I. We both speak Spanish, so that's an advantage for those individuals that are employees of CSU and don't necessarily speak English very well, so we're available for that as well. So this is a snapshot of the resources in Northern Colorado. So there's food assistance, which is the CSU food pantry, if you're aware. The Vindicate Foods, the food resources in Northern Colorado. There is the food bank in Northern Colorado. There's also food pantry within the family medicine clinic. So if anybody's a patient of the family medicine clinic, they can access that food pantry there. And what I've seen in Northern Colorado is that the food that's available through these free resources is really good, nutritious, and it's very inclusive, and anybody can access. And I know that I talk a lot about shame and all those other barriers, but I do encourage people to not only contact me or the EAP, but definitely use these resources. Nobody's less than for utilizing. Everybody, there's times in life that things are rough for a lot of us, and it's okay to utilize these resources, especially the free ones. There's utility help, the City of Fort Collins, there's discounted programs, there's discounted programs for seniors. So our city offers a lot of resources. Sometimes they're a little bit hidden away, so it takes a little bit of research. But this CARE website does a lot, puts out a lot of information there. I don't want to take any more time. So this is the contact information. That's Emma Chavez. You're welcome to take a picture, or her contact will be on the CARE program website as well. Okay. Any questions about what I shared? Certainly reach out to me if you have any.
Oh,
Am I doing this too? I don't know. I'm sorry.
Do you want to do it? I don't care.
Yes. No, because I have to get going.
Okay.
I'm sorry.
Thanks,
sorry.
Fabiana. No, that's okay.
I have another meeting in another room right next door, so I'm. 2 minutes.
Okay, thanks, Fabiana.
Thank you.
I'll go through Commitment to Campus really quickly because we still have quite a bit to cover. But Commitment to Campus is not administered out of HR, but it is a benefit available to employees, and then some of the resources are available to students as well. Offers discounts on and off campus. So this is just a very short list compared to their website, which has dozens and dozens of additional discounts and programs available. Priority enrollment at the Sunshine House and the Early Childhood Learning Center is included under C2C. There's a variety of different scholarships available for employees and after-school programs for the children of employees and summer camps as well. Oh, the order's kind of weird.
That's okay. I thought it was longer.
As I said earlier, I'm Audra Montoya. I'm our Employee Housing Programs Coordinator. And the Employee Housing Program was originally started to support the mission of the program, which is to facilitate access to housing and the recruitment and retention of faculty and staff, and also for the well-being of employees. And hopefully, kind of like we talked about with the When we launched the Wellbeing Hub, hopefully you've seen source articles and emails and other articles outside of CSU talking about the Rendezvous Trail project, but this was a collaboration with some strategic partners, both Tetrad and Timberline Church, to build these apartments. CSU does not own them, so they are owned and managed by Tetrad, but they're building 180 units, and of those, CSU has access to 57 of those units that are available at a discount to employees. And we have all of the information on our website, so employees can look at the eligibility criteria. They can determine if they're eligible. They can look at, obviously, cost is important, right? Look at the cost of the program, look at the transportation options, and see the floor plans. We do have units at 60, 80, and 100% of area median income. So what that means is there are different income levels that are required to access those units, and then those units tied to that income bring with them a different discount. So each level has its own discount and its own requirements. We have, the bulk of our units are at 80% of area median income. All of our 60% units are currently leased, but we do still have availability in both our 80 and our 100% units. And originally the developer was giving us the bulk of our units early in the development and early in the build process, but they had some construction delays. So we still have units that are coming online over the summer, which is fantastic because that's when a lot of people move, is over the summer. So if you know folks who are interested, who think they might be eligible, please encourage them to take a look at the website, or if any of you are interested, I encourage you to check it out. If you have questions, please let me know. We also launched, gosh, it's been about a year and a couple of months, that we also launched the Housing Partners Program. And this is pretty similar to the Commitment to Campus program, Commitment to Campus program that I think most of us are familiar with, where we've been partnering with real estate professionals in the community to provide discounts to employees. And we have 3 home builders, 11 real estate agents, a couple of home inspection companies, and a home maintenance provider offering discounts to employees. And in our first year, we helped save employees over $33,000 in costs and fees in buying a home, so I'm pretty excited about that. And then on our website, we also have a ton of additional resources, and it's a lot to kind of go over, so I just encourage folks to take a look at the website. But we offer home buyer education. We offer those classes once a year. We've been working on expanding the program, and this last year we were able to offer the classes in both English and in Spanish. I also am able to keep them posted on our website for 90 days after the program, so that if folks aren't able to attend, they're able to watch it. We are past that 90 days, so it's off, and I'm only allowed to keep it up for 90 days in case things change. So, the mortgage rates change, or there's been a change in how things are operating. We don't want bad information up. But continue to look at ways to provide educational opportunities for employees around buying a home. There's a bunch of information on there about community resources, whether that's affordable housing programs, whether that's mortgage down payment programs. There are a ton of programs available in the community, and it can be hard to find. So we wanted to have a place where employees could find all of that information. And then the last thing I have, and we also have things like emergency housing. So if folks are they're in an emergent need and they're either experiencing being unhoused or they're facing being unhoused, we've got some resources for employees up there as well. One of the other programs we launched was a pilot program, and that was our mortgage insurance waiver program for folks who are looking to buy a home but didn't have 20% down. Mortgage insurance can be really expensive when you're buying a home, and so this was a partnership with Canvas Credit Union. It was a pilot program, so we did have limited funding, and right now the fund is maxed, but Canvas anticipates that it'll take about a year for that fund to self-replenish. And so that information is all up on the website if folks are looking. So once we know that we have funds back, that'll be updated on the website. And then if folks have questions about these resources or any other resources, they're welcome to call me, to Teams message me, to send me an email. I can answer questions. Sometimes folks want to come in and meet or schedule a time to meet on Teams and kind of talk about the resources that we have available, and I am happy to do that. I think that's it for me. Does anyone have questions about any of those? I'm trying to go quickly because I know there's a lot of other information. Awesome, thank you.
Thanks, Audra.
Up and down.
All right. So just some of the ancillary benefits that we feel like still fit into well-being. The academic privileges that are available for eligible employees include the employee study privilege.
So this helps pay for credit courses at CSU Fort Collins, CSU Online, Global, Pueblo, and the University of Northern Colorado. Faculty and staff who are eligible and are full-time can get up to 9 credits per benefit year. And then credits, of course, are prorated based on working hours, and you do have to be at least half-time to access those credits. And then the tuition scholarship program offers 50% off resident tuition for on-campus credits, and it's available to eligible family members of eligible employees. Some financial resources include the Employee Hardship Loan Fund. So those loans are available to employees who are experiencing a financial crisis. And I believe they can get up to $1,500 and then repay that loan through payroll deduction based on the frequency they choose. And then the Public Service Loan Forgiveness, so also relating a little bit to the tuition scholarship and employee study privilege. We know that student loan debt can cause a lot of stress and mental health issues. So employee study privilege can help address that. Some of the scholarships available through C2C can address that. But CSU is also a qualified employer under the federal government's Public Service Loan Forgiveness Program. So if you meet the eligibility requirements, make eligible payments for, I think it's 10 years for a public service employer, you can be eligible for entire loan forgiveness. So if you've been here for a while or in other public sectors, a program probably worth checking out. And then Fidelity has some resources online that are available to all employees. So even if you're in para, you can still get into the Fidelity portal because you're eligible for the 403B. One of the tools that they offer is Goal Booster, which can help you save for short-term goals. Think like having a child, buying a home. You can open a cash management account through Fidelity. There's no minimum, it's FDIC insured, and you can earn interest on the amount that you save. You can set up automatic deductions from your checking account or savings account and get some pretty good return rates on those accounts. Wellness incentives are also available to benefits eligible employees. So for faculty and non-classified staff, you can earn $150 each year by completing certain wellness activities. For state classified staff, you can earn a discount on your medical premiums, up to $20 a month if you complete the activities for their state of health program. Any questions on those kind of random benefits that we added at the end? No? All right.
All right, thanks, Brittny. Okay, now we're gonna head into kind of some of the more traditional benefits. The way that this is gonna look too, we're gonna talk a little bit about both. You'll see the Faculty Admin Pro on the top, state classified, so we're gonna try to touch on both as we go. Can I get a hand, raised hands, set of raised hands, I don't know, of those who may be state classified? Okay, and then so it looks like we're about half and half here. All of this information that we're gonna go over right now is gonna be very, very high level. We'll do a really quick summary over all of it. But there are QR codes that are on each of the slides that'll give you more specific information if you're looking for anything as we go. So really to start, the plan information, so our Faculty Admin Pro folks, the plan year for them is on a calendar year, January through December. And the open enrollment period usually is very early May for how about November, for a January 1st effective date, so any changes there. State classified is going to be more on the fiscal year, so July through June, and we just wrapped up their open enrollment, which is usually mid-April into early January. If someone is planning to cover dependents on their plan, they're very similar for both the faculty and AP and state classified. The only difference you'll see is the state does not allow coverage of domestic partners. Otherwise, the criteria is the same for both employee types. All right, so what we consider be the core benefits for our employees is Faculty Admin Pro are eligible for $70,000 of basic life insurance. short and long-term disability. And the medical you'll see there is because there we have a employee-only either green or RAM plan, which is at no cost to the employee. So these core benefits are those that are provided for being a benefits eligible employee that are at no cost or paid by the university. Then for state classified employee, it's one time your annual salary for basic life insurance or $50,000, whichever is more. And then the short-term disability, the state offers that plan at no cost as well. Then what are considered our voluntary benefits? So very similar on these two plans. You'll see the difference on the state classified folks is that long-term disability for state classified employees does require enrollment and eligibility for that. Otherwise, the same types of plans exist for both dental, vision, additional life insurance for both the employee and their spouse or dependents, accidental death and dismemberment, a health savings account if individuals are enrolled in a high deductible health plan, and then two types of flexible spending, which we'll go into in later slides. All right, so for our medical plans, for our faculty admin pro employees, there's 4 plans that are offered. All of them are administered by Anthem. We have the RAM plan, which is the high deductible health plan. That's going to be a higher deductible that works with a health savings account. So a tax-free plan that you can use for healthcare expenses. Then we have the green plan, which has a little bit lower deductible than the RAM plan. And then after that deductible is met, those plans have co-insurance. So essentially the portion that you pay after your deductible has been met. So in most cases, that's going to be 20% that the employee is eligible for or responsible for. We also have the gold plan, which again has a little bit less of a deductible, but that plan is frozen to new enrollments, and new employees coming in won't have access to that. That's only in existence for those who are currently enrolled. And then we have the point of service plan. So co-pays instead of that deductible, and then some co-insurance still exists once those co-pays have been met. So the premiums for all these plans are included in those 2 QR codes. Those are going to go to what we consider the summary plan description, so the more definitive details on all of those plans. The bottom one will go to the state's equivalent of their summary plan as well. You will see, though, that the bottom QR code is going to go to the new plan information, so the plans that are going to be applicable for July 1st. And they're very, very similar to what they look like today. It's just the premiums are a little bit different, and there's one change on our flexible spending account. Otherwise, that link is very close to what you'll see for the current plan year. Then for our state classified staff, they have 3 plans that are offered by both Cigna and by Kaiser, so 6 plans total. So there's a high deductible health plan, again, similar to that faculty AP plan. And then they have 2 copay based plans. So the copay basic and the copay plus, and they both have a bit of a deductible. On that copay plus plan, it has a lower deductible and lower copays for many of the services versus those other 2 on the basic plan. And then the difference that you'll see between Kaiser and Cigna is that Kaiser is what's considered an HMO plan. So you are required to go to Kaiser facilities, which there's some in Loveland, there's one in Greeley, and one in Fort Collins. So those give you a more streamlined kind of approach to your healthcare, but you are in essence restricted to going to those locations only. The Cigna plan is going to have a wider network, so you can go to UC Health, you can go see some Banner facilities. So that one gives a little bit more flexibility on what providers that you can see. All right, so that health savings account, if you're enrolled on the faculty admin pro side in the RAM plan, that's going to be the high deductible health plan that works in conjunction with an HSA. And what that is it allows you to essentially pay for healthcare expenses. It can be portions of your deductible, it can be co-pays, it can even be some certain products that you can buy. I know that sunscreen and contact solution, those types of things can also be paid for with a health savings account. And it's not limited to just healthcare. You can use it for dental visits, you can use it for vision, and then those for yourself and your qualified tax dependents. So a legal spouse or children that you still claim on your tax returns, their expenses can be paid by this health savings account as well, even if they're not covered under your plans. So on the faculty admin pro side, for the state, for the HSA, the university gives you $500 per year to put into that health savings account. And then the state offers $60 a month or up to $720 per year that gets put into that account. And then you can make contributions on top of that, which you'll see down to these maximums. So if you have individual coverage, up to $4,150, or if you have dependents covered under your plans, you can contribute up to $8,300. And there are catch-up contributions if you're over a certain age as well. These amounts are going to be less the contribution amounts that come from both the university and the state. And then essentially the benefit of it is that they're considered pre-tax accounts, which, let's just say, for example, you put $50 a month into that account. It's going to come out of your income first before it's taxed. So it's essentially going to lower your taxable income by that $50 or $100 or whatever you contribute to give you tax-free savings. All right, then our dental plans. So all four of the plans are administered by Delta Dental. For our faculty admin pro plans, we have two. One, which is considered our basic plan, which is a direct reimbursement. So it doesn't necessarily function like your typical insurance plan that you're used to. It basically just reimburses you for costs of the services that you receive. So it's 100%, pays 100% of the first $100 of expenses, and then 50% of the next $1,800 per year. So it doesn't matter if you get a cleaning, if you have a filling, they're just going to reimburse you for those costs. Then the plus plan is going to be more like your typical insurance plan. You have small deductible, and then the plan pays at 80%, 60%, and 50% depending on the types of services. The Delta Dental Plus plan is the only plan that offers orthodontia. So if you have braces or have kiddos that need braces, that plan is going to be the one that you'll want on the AP plan. Then state classified, theirs are both traditional insurance plans. So the Dental Basic and the Dental Basic Plus are very, very similar, except you'll see the maximums are a little bit lower on the basic plan, and then the percentages that are paid by the insurance are a little bit lower as well. And then just similar to the faculty and AP plan, the Dental Basic Plus plan does offer a $3,000 maximum on orthodontia on that plan. It's not covered on the basic plan. And you'll see both of those are lifetime benefits. So that's essentially up to that percentage for each, and this is for each person covered on the plan. So whether you as the employee or each of your dependents will still have all of these maximums specific for them. So it's not going to be cumulative for your entire family. Both of these plans also have a program called Prevention First, which basically means that you can go get your preventative services, so your cleanings for both yourself and any dependents, and those don't go toward the maximums. So that gives you a little bit more of the ability to, if you have services that are needed under dental, that those preventative services don't count toward those amounts. All right. Any questions on the medical dental? I know that was like super quick. All right. So now quickly for vision, AP faculty, we use the vision service plan. For that program, eye exams at a $40 copay. You are eligible for basic lenses at $25 and then up to $175 allowance for frames or contact lenses. So if you do frames, you're eligible for those every 24 months, or if you do contact lenses, those you're eligible for every 12 months. Then on the state classified plan, there's two vision plans for them. The basic, you'll see the copays are a little bit higher for those lenses and the $130 allowance on that basic plan, or increases to $225 on the enhanced plan. The state classified plan does offer glasses or contacts every 12 months. So a little bit different from the AP plan. All right, so life insurance, this would be in addition to the basic life that every employee is eligible for. And a person can request insurance, additional amounts for themselves or for their spouse or partner, and then a flat amount for any child. And these do require, there are what's considered guaranteed issue amounts, which essentially means you can elect up to a certain amount per open enrollment or per mid-year event, which would be if you got married, if you welcomed a child. Those guaranteed amounts are approved up to a certain dollar, and then you may have to do medical underwriting for anything above and beyond that, up to the maximums on the screen here. The state classified plan works a little bit differently on their life insurance for spouse or partners. So the maximum for employees for the voluntary is $500,000, but the state limits any amounts for spouses up to half of what that amount is. So if someone were to elect the $500,000, you could elect up to $250,000 for your spouse or partner. But if you had $100,000, you'd only be able to elect $50,000 up to that. So it's always going to be half of what the employee's amount is. And then there are two flat amounts for child, $5,000 and $10,000. And neither of those policies on the AP or state classified plans require medical underwriting or approval for children. Those are automatically approved at those amounts. And then premiums are just based on the age of the person who's applying plus the amounts that are elected. There are some additional services that you'll see. Travel assistance, that's great on both of the plans. So if you're traveling at least 100 miles from home and you lose your wallet, you need to help getting a prescription, anything like that, the travel assistance programs can help in emergency type situations to have provide services if necessary. There's also further travel if you're, let's say, out of the country and you are ill or you get injured and you need to be transported to a location that can more appropriately care for you. That travel assistance program will pay for the transportation for you to be moved somewhere else. So those don't require any additional enrollment. They're just basic plans under each of the life insurance policies. So there's information on our website too on how to hold on to that phone number if you're traveling and need to utilize those services. All right, so very quickly, flexible spending. These are similar to a health savings account, except these are pre-tax savings for those who are not enrolled in a health savings or a high deductible health plan. So let's say the green plan or the gold plan for faculty admin pro, or either of the two copay plans. So the healthcare expenses can be contributed up to $3,050, and these are IRS maximums too. So anything up to those portions there. And then dependent care, which is going to be daycare expenses for children under 13, you can contribute up to $5,000 to pay for daycare expenses. Now you'll see on the state classified plans, they have two. They have what's called a general purpose, and that plan is for those who are not in that high deductible health plan, and those can be used for any type of services just like the HSA. But then they have also what's called a limited purpose, which is for those who are enrolled in the high deductible health plan and who have a health savings account. That limited purpose account allows you to be enrolled in both of those plans, but it's only for dental and vision expenses. So it kind of gives someone an opportunity to create a little bit more or put aside a little bit more for healthcare expenses between those two plans. Otherwise, you are unable to be enrolled in a flexible spending account and a high deductible health plan. The IRS prohibits that. And then the daycare expenses, again, are going to be the same on the state classified side. All right, Just really quick on retirement. So our faculty admin pro employees, each employee type is required to contribute to retirement. CSU is a non-Social Security employer, so these contributions are basically in lieu of any contributions that a person would otherwise contribute to Social Security. So for our faculty admin pro, there's two potential options. Most employees will be eligible for the defined contribution plan. That's through Fidelity Investment. And it's an 8% contribution. And for those who are in an eligible employee category, will receive a 12% match on top of that. Then there is some criteria for those to contribute to Colorado Para. In some circumstances, different criteria if someone is newly eligible that's had previous para service. And currently that contribution is 11%. And then there is in essence a match that goes to para for those contribution amounts, which is a little bit different than the 12% that goes to the DCP plan. Then all state classified employees, whether they are salaried or hourly, contribute to Colorado Para at that same contribution rate. And then there's 3 avenues for voluntary retirement. So a 403B, a 401k, and a 457 plan. Those are going to supplement your retirement program in addition to the Colorado Para. So if you wanted to put aside additional amounts. The 401k and the 403B have a combined limit, 22,500, 23,000? 23,000. And then there's catch-up contributions on that based on age as well. So a separate 23,000 contribution limit on the 457 plan. So it essentially gives you 3 options to contribute more than your mandatory plans. All right, we're gonna go real quick on leave. So for our benefits eligible faculty and admin pro employees, full-time employees, they accrue 10 hours of sick leave per month. And then for our 12-month employees, they accrue 16 hours of annual leave. 9-month employees don't currently contribute or accrue annual leave. Then for our state classified employees, every employee accrues 6.66 hours of sick leave. And then the annual leave accruals are anywhere between 8 hours and 16 hours per month, and it's based on years of service. So the initial amounts up through year number 3 will accrue 8 hours, and then I believe after 15 years, it goes to up to 16 hours, and then there's a 2-hour difference between each kind of level that you meet for years of service. Annual leave can be used for any of your personal needs, including vacations. That does have to be approved in advance by your supervisor. And then sick leave is going to be for the use of any treatment or recovery of your own serious health condition or even doctor's appointments. But that can also be used for those of your family members as well. So if you're taking a spouse or kids to the doctor, you can also use the sick leave in those cases as well. All right, super quick on disability. I know this is like a super busy slide. There's a lot going on here. Again, that short-term disability plan for faculty admin pro, core benefit, everybody is eligible for that plan as of their date of hire. If a person needs to apply, they are eligible for up to 100% of their income replacement or 100% income replacement after a 10-day waiting period and the exhaustion of all sick and annual leave accruals. This criteria for the disability, short-term disability for both APs and classified is a little bit different now that we have Colorado Family, which I'll talk about in the next slide. So while this criteria still exists, there are some caveats and coordinations with it when a person is also going to be eligible for Colorado Family. Back to this faculty admin pro side. If an employee is eligible for short-term disability for their own serious health condition, they may be eligible for up to 60 working days or the duration provided by the healthcare provider. The state classified plan is very similar, except there's a 60% of income replacement after a 30-day waiting period. The classified plan does not require exhaustion of any accruals first. So once someone meets that 30-day waiting period, they could be eligible for short-term disability. And that plan has a 180-day maximum. That 180 days includes the initial 30 days, so it's essentially 150 days of benefits. Then the long-term disability plan on our AP side, that is either 69% income replacement if someone contributes to Fidelity, and 60% if to Colorado Para. And those are different because Para also offers disability benefits, so the income replacement's a little bit lower on that LTD plan. And then the maximums on both that and the state classified plan are really based on the person's age at the time that the disability occurs. So it doesn't necessarily have those workday maximums like the short-term disability plans do. And then long-term disability does require medical underwriting. So if a person chooses to apply for that long-term disability plan, it requires a medical history statement. And then the third party that the state uses, which is UNUM, will have to make a determination if someone is eligible for that plan or if they're essentially too much of a liability to allow the long-term disability program. That's open during any time, doesn't have to be elected during open enrollment. It's what they consider an after-tax benefit. So you could go in today or next week or 6 months from now and apply for long-term disability. And then if you ever have the need to actually apply for the benefit because of your own serious health condition, you can just contact our HR team and we will walk you through that process. Or you can see Stephanie too, and they can also help you too.
So the long-term disability for AP is 69% of the income if you're enrolled in DCP?
Correct.
Okay.
Yes,
I
correct.
want to make sure I understood that correctly.
Yes, thank you for the clarification. All right, and then this is going to be like the really quick super snapshot over family, because we could probably stay here all afternoon and talk about it. So we'll do some really quick overview of this. And then if you do have questions about family, I encourage you to reach out to our HR team or to your student center HR team too, and they can definitely help walk you through that process or guide you to us on this. So Colorado Family is essentially the new paid family leave that was introduced in this past January 2024. And it was based on it was voted in 2021 as this paid leave option for all employers and all employees throughout the state. So as long as a person is eligible, or as long as a person resides and works in the state of Colorado, they are eligible to apply for family for their own serious health condition or that of an eligible family member. While there's not a waiting period for someone to be eligible for this plan, you could start today and be eligible for family tomorrow. And this includes all employee types. So this is student employees, this is non-student hourlies, our faculty, admin, pro. There's not a restriction for those employees. But you will see the second bullet, which is job protection. So as long as a person's been employed for at least 180 days, this also provides job protection through the duration of what that claim looks like. Benefit income replacement is on a sliding scale. It's up to a weekly maximum of $1,100, and it's based upon the amount that you make. So the more you make, the less you receive, the less percentage essentially that you receive. The less you make, the higher percentage of your weekly wage that you receive. And the way they look for it essentially is that family uses an average calculation of the previous 4 of the previous 5 whole quarters. So it's not necessarily based on someone's income today. It's going to look back essentially a year and what a person's average weekly wage is from a year ago. And that's what someone's going to be eligible for today. We do the calculation on the back side of it. and let all of our individuals know what they're eligible for if they apply for family. So what family provides is up to 12 weeks per year to care for themselves again, or a family member. This may be for someone's serious health condition, for an injury, for an illness, or also welcoming a new child. So that's going to be for both what we consider birth parents and non-birth parents, so they can both apply for family in those situations. This will run concurrent, so together with family medical leave. So you may be familiar with that already. So 12 weeks, 13 weeks for state classified employees, but this essentially provides the income replacement for what family, the job protection portion of family medical leave. And then in addition to FML, family is primary to those disability plans that we talked about previously. So essentially a person would apply for family first, and then we would coordinate any disability that might need to be applied for at that point. Same for our parental leave programs for those that are welcoming new children. And then the last portion here, probably the most important part for CSU family, is that we have our own private plan. So it runs concurrent and it has the same eligibility criteria as the state of Colorado. So they don't differ from one another in that regard. We just essentially administer it at the CSU level. So you apply directly through CSU if you would need to apply for family. The state of Colorado has a portal that all other employees and through other agencies or through other private plans will apply directly through the state. So please don't do that and come directly to CSU if you have an application there. But this can be, there's a lot of variance that for eligibility and what a person's eligible for and how you get paid. Variety of different things that we don't have to cover in 3 minutes. So again, let us know how we can help. Reach out to us about how we can provide guidance on CSU's family plan. And with a few minutes to spare, we're done. Any questions, or we can stay a little bit after too if you have other questions that you want to ask specifically of us. Otherwise, is there anything online?
Nope, no questions yet. I'm going to stop the recording now.
Okay.